Navigational bronchoscopy is a procedure used to check abnormal areas of the lungs. These abnormal areas are called nodules, which are built-up areas of tissue that can be cancerous or non-cancerous. During the procedure, the patient is put to sleep using a general anaesthetic, and a narrow tube called a bronchoscope is passed through the mouth of the patient and down into the large airways. A detailed roadmap based on a scan of the lungs is used to navigate a special bronchoscope to examine these nodules. The examination also involves taking a biopsy, which is removing a very small sample of the nodule. The tissue from the biopsy can then be tested to find out whether the tissue is cancerous. Navigational bronchoscopy allows doctors to see much more of your lungs than would be possible with a traditional bronchoscopy, while also reducing the risks related to other methods for taking a biopsy. Furthermore, it allows doctors to perform tests to determine if the lungs are infected with bacteria and prescribe targeted antibiotic treatments. Hello, my name's Jeanette. I underwent a navigational bronchoscopy which helped to spot my cancer at an earlier stage than what would otherwise have been possible. Getting told you might have cancer drops a bombshell on life as you know it. For me, a faster diagnosis meant that I could access treatment more quickly and start to put my life back together. I'm so grateful that this procedure was available to me and that it's helped me get back to doing the things that I love, like swimming. My potential cancer was originally spotted during a lung health check. As these checks are rolled out across the country, more and more people just like me will go through the same process of worrying and waiting to find out if they have lung cancer. In the rest of this video, we'll be sharing why navigational bronchoscopy can offer some real hope for patients and practical help for services.
We've seen through a number of studies in NHS settings and globally that navigational bronchoscopy offers safety advantages over traditional diagnostic procedures without sacrificing diagnostic yield. Most importantly, there is a significant reduction in complications with navigational bronchoscopy versus procedures such as CT-guided biopsy, whilst maintaining diagnostic accuracy. In fact, for the small and harder to access nodules that we're seeing more of through referrals from lung cancer screening, navigational bronchoscopy is actually a more accurate option. We're now able to biopsy very small nodules right away, whereas otherwise we'd be asking patients to wait for months to see if the nodule changed. Because the risk of complications is lower, navigational bronchoscopy also tends to be a safer choice for patients with complex or severe comorbidities. What I've also heard in my clinics is that patients prefer the idea of navigational bronchoscopy as they are under general anaesthetic rather than the discomfort of procedures while they are awake.
Hello, my name is Faith Smith and I'm one of the lived experience partners at the Health Innovation Network, South London. From talking to patients who have gone through the lung cancer diagnosis process, we have learned that getting a clear diagnosis as quickly as possible makes a huge difference. For many patients, especially those who might already be faced with health challenges, this means fewer trips to the hospital and less risk of complications compared to other diagnostic tests. It's really about making the whole process easier and more manageable. If navigational bronchoscopy does find a cancer, it allows patients to start treatment sooner, which can lead to better outcomes. We know that this reduced wait for treatment is particularly important for groups who experience cancer inequalities, such as those who are from more deprived areas who often present with lung cancer at a more advanced stage. Patients have also told us that they are reassured to know that smaller nodules can be checked right away, instead of waiting for months with anxiety and uncertainty. Navigational bronchoscopy offers a number of real benefits to patients, not just in terms of clinical outcomes, but also quality of life during this extremely challenging time.
Improving the speed of diagnosis and onward referral is an absolutely critical priority for our service. Like a lot of services, we've made lots of incremental improvements to our pathways in recent years, but we were interested in navigational bronchoscopy because it offered the chance of a real step change. We saw a significant opportunity to remove one of the big bottlenecks affecting our waiting times. At Guy's, bringing in the procedure has meant we've been able to give faster and more equitable access for diagnosis for our patients across our region. We've now also got a more flexible pathway where we can investigate several nodules at the same time or access small nodules straight away, where in the past we've had to tell a patient to wait for several months before they could be considered for diagnosis or treatment. The impact on our overall waiting times and quality of life has been immense.
Across the lung cancer system in England, I think we can all recognise that we're working in a time of significant change. The rollout of targeted lung health checks and improvements in detection mean that we're seeing more and more patients who need urgent investigations. For us, navigational bronchoscopy has been transformational in terms of preparing us to deal with the increase in need and patient throughput on top of an already very busy cancer pathway. We've been fairly early adopters, but the technology and the practicalities of implementing this procedure into lung pathways have matured quickly. It's at a stage now where collectively we think this procedure needs to be integrated into pathways similar to diagnostic procedures like EBUS. So my message to surgeons, respiratory physicians and service managers who might be watching this and thinking about whether to start the process of introducing this technology is to go for it. Yes, there is an element of disruption, but the return on investment is absolutely there. And there is support to help with managing the practicalities and the transition of a gradual scale up of these services.